how does artificial intelligence change your practice as a doctor? And how does artificial intelligence change your patients?
Just because somebody is going to gym or somebody is running or somebody is cycling and from outside they look healthy and fit, it doesn't mean that inside also they are healthy and fit. For example, spending a lot of time on social media, we already have these debates happening, and we know that too much of screen time or aimlessly watching reels, they are not good for children and for anyone basically.
Hello and welcome to my podcast, The Healing Monk. I am Dr. Suman Das, your host. Well guys, today we are going to speak about brain. In fact, brain is something that controls everything, but we seldom talk about it. We talk about fitness, we talk about diabetes, we talk about heart, but we don't talk about brain until we really face the problem with something like memory loss, depression, or stroke. So all those problems, until that comes, we don't really think about brain health. I have a guest with me who is a clinician par excellence, trained in an institute like CMC Vellore, and is presently working as a senior consultant neurologist at Apollo Jubilee Hills in Hyderabad. More than that, you all know him because of his simplified posts in the social media, where he simplifies the complexities of the clinical situations and also helps in removing the misinformation that is so prevalent in the social media in the present day. Yes, I am talking about Dr. Sudhir Kumar of Hyderabad. Before going ahead, please watch this entire podcast. It will be really helpful for you. And if you find value, then definitely subscribe us. Sir, namaste.
Thank you, Dr. Suman. It is my pleasure to come on your podcast. And I'm sure, as you mentioned, we'll discuss many things which could definitely benefit all the viewers that who routinely watch your podcast.
Sir, first question. दिल बड़ा है या दिमाग?
देखिए, ये तो मतलब हम लोग हमेशा बोलते हैं कि ऑलवेज आवर ह्यूमन माइंड इज सच दैट वी वांट टू कॉम्पीट. अगर हम देखें तो डेफिनेटली दोनों का अपना इंपॉर्टेंस है, बट व्हाट डिफरेंशिएट्स वन ह्यूमन बीइंग फ्रॉम अदर? वी से देयर आर सम ग्रेट ह्यूमन बीइंग्स. दैट ग्रेटनेस डिपेंड्स ऑन द ब्रेन. सो ए पर्सन कैन बिकम ग्रेट. आई एम नॉट सेइंग ग्रेट इन टर्म्स ऑफ मेमोरी और इंटेलिजेंस, बट जस्ट बाय ह्यूमन वैल्यूज, एंड ऑल दोज वैल्यूज are in the brain. So from that point of view, brain is superior. But yes, brain depends on the heart for survival.
Definitely, sir. Which in the present day, we seldom recognize the problem that is called as the brain health. So what is the good brain health as per you?
Definitely. See, today, not today, always, right? And at every stage of life, the brain health needs to be good. It is not only, for a student or for a person doing the job or for a housewife. Everyone needs a good brain health. For a child, a good brain health can be something where the child is able to learn properly, play properly. It's not only learning and studies, even playing equally important. And interpersonal relationships begin at that time. So how to talk to parents, the contemporary colleagues. So a good and healthy brain is something where they can, decide, they can see far, that small things don't matter. The brain has the ability to decide what is good for you, what is good for the world, and then take it forward. So a good brain health is something where the brain knows what to do, what not to do, differentiate good from the bad, and then keep on practicing those which maintain the good overall health for the body and the person.
Suppose someone is in the teenage. So during the teenage, we see a lot of change in the behavior of the child. And how does our brain development relates to that?
Yeah, that's very important. So basically, one is to look at the growth and development of the child as a whole, and then also the learnings from the watching others. So one is definitely the brain matures at every stage, from the infancy to the preschool age, and then the school age, and then adolescence. So the brain is maturing. We have more and more number of nerve fibers. They get myelinated, and then the gray matters also develop. There are more connections in the brain. So that is the neuroanatomical changes that is happening in the brain. At the same time, brain learns a lot from watching others. So the child has been watching parents at home. They also watch other children, and now there is exposure on the social media, TV. So by watching those things also, the children also get influenced. Now what happens is when the child is very young, let's say at 4 or 5, they're almost fully dependent on the parents, and at that stage the needs are limited. They need good food, maybe good safe environment for sleeping, and of course love and care are important. So those things are easy. But then as the child grows, then their needs also start expanding. And sometimes the needs can match the parents' needs also, and they can justify. But nowadays there are a lot of pressure where there could be small conflicts. Parents may think it is not correct. The child may think it is correct, and that starts happening in teenage, because at that stage brain is quite mature, not like a preschool or early school days. So that is where some conflicts can happen, and some
They're mature but not stabilized.
not stabilized.
Yes.
So they feel that they know everything, whereas definitely parents have seen more of the world. So they also know that the child can go wrong. For example, spending a lot of time on social media. We already have these debates happening, and we know that too much of screen time or random aimlessly watching reels, they are not good for children and for anyone basically. So if parent says that, and at the other time, at the same time, if mother is watching or the father is doing the same, so then the child gets some kind of rebellious, that if you can do, why not I?
Not I.
So the parents have to set an example, then these conflicts will be less. But sometimes, despite everything, this can happen. It's the normal part of growing up. And I think all parents who have teenage kids, they have gone through it and they know how to manage.
Secondly, I have read in one place that prefrontal cortex is the last part of the brain to develop, which basically controls our executive decisions. And that is the reason why the parents try to control children, especially between that age group of 15 to 20, where in that time the prefrontal cortex develops. Is that correct?
Yeah, basically the brain is developing all the time. And then, as I said, one is the brain growth, and second is we are learning from the environment by watching others and by reading and watching. So the parent's job, when you use the word control, that control is little bit, nobody likes it, whether it's a child or teenager or adult. So parents should be a guide. So if parents can, if the child and the parents, they should be part of the same team. So it should not look like they are two opposing teams and fighting with each other.
Friends.
So the parents have to show the child, okay, what is the goal? Why we are doing it? So instead of saying, switch off the TV, they should also add why we are doing it, and also they should provide the child with the alternate option. If I say don't watch phone, don't watch TV, then the child can turn back and say, then what do I do? So they should be ready. Okay, read books. We all have done it. It's easy for current generation parents because we have gone through the phase when there were no internet and no TV and no phone. So we know that we can play games, we can read books, we can just talk to people, real people, rather than chatting on the social media. So we have to give them options, what can be done. And if the child starts enjoying that, automatically he will not do what the parents don't want him or her to do.
Correct. So again, coming back to our brain health, sir, how does sleep affect the brain health?
See, if you ask me, it is one of the most underrated things. And if you ask me, if any patient asks me, doctor, give me the strongest pill for improving brain health, the strongest pill is 7 to 8 hours of good sleep. And we can think that, sleep, it is the easiest thing to do. You just have to lie down on the bed and you can get the sleep. And almost everyone today has a house or has a home or has a bed where he or she can sleep. But you'll be surprised, almost 40% of people, or some studies have shown more also, do not get adequate amount of sleep. So 7 to 9 hours of sleep is a must. Now, when I say it is a must, why is it a must? If you look at the randomized control trials, then observational studies, all of them have consistently shown that people who routinely sleep for 6 hours or less, they have a high risk of overweight, obesity, diabetes, high blood pressure, heart attack, stroke, dementia, including Alzheimer's disease, certain forms of cancer, and they also have higher chance of premature death. So sleep deprivation is one of the biggest risk factors for all the modern diseases which are unfortunately rising. So that is why I say that for keeping brain in good health, one must sleep optimum for 7 to 9 hours. And other thing is consistent sleep. So it is not that somebody say, okay, one day I'll sleep from 1 a.m. to 8 a.m. That is also 7 hours. Next day 2 a.m. to 9 a.m. Again it is 7 hours. But that is not going to work.
Circadian rhythm will be.
Yes. So there is a biological clock. So we have to start going to the bed at the same time. We can have a difference of half an hour plus minus. But consistent sleep schedule also is important.
What should be done so that we call it a sleep hygiene?
Yes.
What is a good sleep hygiene?
No, it's a very important question. So we are talking about a group of people who have the time to sleep and they are at home also at the right time, but they're not getting the sleep. So for that, one is to first, make a consistent sleep timing. So somebody can decide, okay, my sleep time is from 10 p.m. to 6 a.m. Occasionally it's fine, but routine should not be scheduled in your sleep time. No activity should be scheduled. That is number one. Second thing is, we have to have some kind of ritual for the night, which means having dinner about 3 hours before the sleep time. So suppose somebody has to sleep at 11 p.m., he should complete the dinner by 8 p.m. Now, it is not only for good sleep, it is also supposed to reduce the risk of GERD, reflux disease, and then it helps in digestion. The sleep quality also is good in those who have early
Even insulin sensitivities, glucose spikes, etc.
all those things are there. So that is number one. Second thing is the screen time. So at least about an hour before the bedtime, we should try to switch off the screen for 2 reasons. One is that the blue light is supposed to influence negatively the sleep centers and biological rhythm can get affected. And second thing is if you are watching some content which can be distressing, because social media generally shows the negative news more. So if you open Insta or YouTube, you're more likely to go to those negative contents like some war videos or some crime scenes, and that can play at the back of your mind and affect your quality of sleep. So 1 hour at least we have to give off time. And then if somebody has a ritual of, let's say, going for a post-dinner stroll for 15-20 minutes walk, that is good. Keep the room temperature little on the colder side, which is comfortable. You should not be too cold or too hot. Again, sleep is not good. Light, so that room should be totally shielded. So many studies have shown that even if small amount of street light also, if it filters through the curtains and come inside, then the quality of sleep is affected and they have a higher risk of getting stroke at a later date. So there are some recent studies which have shown that. So we need to have good curtains which can totally shield the outside light, and what is called ambient light of the city filtering inside. And of course, this noise and other things should not be there. And the phones should be kept away from where the hand cannot reach. If despite doing all these things, if someone doesn't get good sleep, they should consult a doctor. It could be a sleep apnea or one of the sleep disorders where proper evaluation can detect.
So melatonin, which is nowadays so many social media posts and all we hear about giving melatonin supplements in the night. Is it recommended regularly?
See, there are two parts to it. So there are some specific indications where melatonin is recommended and it is safe. The commonest example is jet lag. So nowadays people are traveling across time zones, and there the real issue of having this sleep rhythm gets upset. For a short duration, it is helpful in that. Also, people who do shift duties. So some days night shift, some day shift. So like in medical field also, plus say airlines and hotel industry, hospitality. So there also it's recommended for short duration use. Now, someone who has totally fixed duty schedule, they are not traveling across time zones. In such people, generally it's not recommended. Especially in the recent one trial research was published where it showed that people who took long-term melatonin supplements, they had little higher risk of heart failure. Now, this is just one study. So I'm not trying to scare. It is still melatonin is one of the safest supplements because in many countries it is given across the, over the counter, without doctor's prescription. In India, it's a prescription drug. So I would say short-term use for the indications I mentioned, it is safe. But routinely, let us not make it a habit to use melatonin for a long time, for say months to years.
Let us say 3 first things that we should do after getting up.
First, I'll tell you what we should not do.
Yes.
So after getting up, we should not touch the phone. Because if you touch the phone, 2 things can happen. One is that you will lose about, say, half an hour of your time. And that half an hour time, many people tell me, the doctor, I don't have any time for exercise. How do I exercise? That half an hour time can be used for exercise. Somebody who wants to meditate, so that time is very useful. So early morning, basically, again, it's a process, like the process we described before sleeping. So after getting up, maybe just you can have quiet time for a few minutes. If you are waking up, the outside views are generally very good in the mornings. Many people don't see sunset because office finishes late. But if you are not seeing sunset, at least sunrise you can see. And most sunrises are beautiful, They are so beautiful that if you see it, you will feel like clicking a picture. You may have clicked 100 sunrise pictures. But 101st time also you want to click because it is that beautiful. The birds chirping, people just going and doing their daily activities. The milkman is coming or somebody is just carrying flowers. But so many things are there which are only seen in the morning.
That makes our brain active.
Yes.
It makes the amygdala basically.
Correct. And then, of course, once, these 4 or 5 minutes are over, maybe if because overnight you have not had any water, so small amount of water is fine. And then those who like exercising, like for me, mornings are the best time. So then 40-45 minutes of any exercise, whether it's a gym or running or walking, that's an ideal time because even traffic is less, pollution is less. And then you can get it done. Exercise in a fasted state, running is also good for people who are trying to lose weight.
Again, if we see the mobile in the first thing, suppose something negative we see, then entire day is affected by that negativity.
Correct. So, of course, if you are a doctor or if you have expected some message, you could check that. But it should be planned. Okay, I'm going to check that. It's not like aimless scrolling should not be done in the morning. So if you have 1 or 2 things, specific things to check, you can definitely do that. There's nothing wrong in that.
So as we speak about exercise, does physical activity in the morning helps in improving the brain connections and rewiring ourselves?
The second most strong pill for good brain health is exercise. Now, when we talk about exercise, it is both aerobic exercises and strength training. Both are good for brains. So I'll just explain you. So if you look at aerobic, commonest things people can do is brisk walking. Some people can do running also. And few can do cycling, swimming. So any of these activities, all are good. Again, we should not start comparing, is running better, is cycling better. No, do what you like, or you can even mix and match. Consistency. Whatever you can do consistently in your home, in your surrounding. So what is convenient, what is accessible, what you can do 4 to 5 days in a week, pick up that habit. So that, exercises, what they do is they make, it helps in releasing a chemical called BDNF. So brain-derived neurotropic factor. And again, that is good for the brain functions. It slows down the brain aging. And then other things, they reduce, if somebody is already overweight or obese, the weight reduction happens. They also help in reducing the risk of diabetes, hypertension. So overall, the risk of stroke, dementia, they reduce. And people start feeling better. So if they already had a little bit stress, so it's like a stress buster. So any exercise will make the release of this hormones called endorphins. So it's a feel-good factor. So there's something called runner's high. So those who run 45 minutes after that, they feel little euphoric. So that is because of the release of dopamine and endorphins they are good chemicals of the brain. So one is the immediate benefit, and then the long-term benefits are there. Same with strength training also, we should not underestimate the importance. So 20 to 30 minutes of strength training at least 2 or 3 times in a week is all that we require. Of course, if you are really interested in bodybuilding, you can do more also. But this is the 60 minutes in a week is the ideal sweet spot for brain benefits. And same thing. So there also we know that it helps in boosting the mood, and reduces the risk of long-term brain disorders. So those things are well known, and also they are good for improving insulin sensitivity. So the lower risk of diabetes and post-meal hyperglycemia. So the one should combine both for a better brain health.
So nowadays, again, we talk a lot about supplements like omega-3 fatty acids or zinc, magnesium. So for a person beyond 40 years, let us say, and reasonably active, what are the supplements that are recommended?
Okay, that is very important because now there is heavy marketing. So there is a lot of information and misinformation regarding supplements. So first, one sentence I want to say is that there is no one single supplement which is required by 100% of people over 40, which means we have to make it individualized. So everyone cannot be told, okay, you take this supplement. There is no such supplement in the world which everybody takes. So one thing is that we have to look at the diet profile. So if a 40-year-old person is eating everything and all the minerals and vitamins he is getting from the diet, there is absolutely no need. But yes, so now the question comes, who needs supplements? So if somebody is heavily into bodybuilding, so obviously they require higher protein, 1.6 grams per kg of body weight, which our routine diet may not be able to provide, especially those who are strict vegetarians or vegans, because for them it's difficult. So they may require supplements like whey protein, and whey protein is absolutely safe. For those who need them, they are absolutely safe. And of course, it is good to discuss with the physician and the nutritionist and then decide. Other thing, bodybuilders, they may require, and also, so those who are exercising on a regular basis, both men and women, including children, they can take. Other supplements many Indians require is B12. Now, B12 is a vitamin which is required for nerve health, brain health, and also for the blood. So if there is deficiency of B12, they can have anemia, that is low hemoglobin, and it can cause tingling, numbness of the feet, burning of feet, forgetfulness. Today also I had a patient who had low vitamin B12 and he developed memory loss for the last 6 months. He's only about 50 years old. And then with the investigations and his diet profile, we could confirm. But he will improve with treatment. So B12 is something in India because most people are vegetarians. So we should keep in mind, and then if they have a deficiency, definitely. Or if somebody is going to be on vegan diet for long term, they require long term routine B12 supplements. Vitamin D is another thing. Sometimes it is overused also. Sometimes, without reason also. So if somebody is having, let's say, vitamin D deficiency, which is like below 12, or insufficiency below 20, so they require. But if it is say 27, 28, as per the guidelines, they don't require. And also we should look at natural ways. So 15-20 minutes of sunlight exposure will also help. So these are the main supplements we should look at. But as I said, routinely nobody requires all the supplements.
But many a times people talk about omega-3 fatty acid, especially for the brain health or memory.
Correct.
So is that...
Yeah, that also if we are having, say, if we look at, say, some seeds, nuts, and also our salmon, sea fish. So those who are consuming those foods, they'll naturally get it. But of course, if somebody says, no, I'm not going to consume all that, then other option is to get them from supplements.
There are a lot of things people speak about the superfoods.
Mm-hmm.
Okay. But we know that in like a country like India, we don't have all those avocados. Those food are not available also.
Correct.
So what are the best diet plan that you would suggest so that people get all these supplements and they don't need to take any other?
No, definitely. It's a very good question because see, we need not go for exotic stuff like avocados or, this blueberries, strawberries. Of course, now we are in India also, we grow them, but sometimes it may be out of reach of common men. Okay. Where somebody was not earning, and in our country, we have many such people. So we have to focus on what is locally grown and seasonal. So if somebody eats a balanced diet, they can get all the foods. So one thing will be, say, whole fruits. Now we need not go for packaged fruit juices or even fresh fruit juices. So whole fruits which are seasonal. Now if you are going to eat, let's say, foreign apple, for example, so it will take several months from the time of harvesting, then they are stored and then transported until we get it. So in that we are getting the sugar and maybe a little bit of fibers, but all other vitamins have got lost in that. So whereas if you go for local apples, let's say Shimla apple or Kashmiri apple, it will take hardly few days or few weeks from their harvest
to
to reach us. So we can focus on that. It's not that if foreign apple is better than Indian apple. Okay, why the cost becomes, see, they can be, cost can be lower for them because their cultivation methods are better. So if the same tree can yield more fruits, so they're able to sell for lower cost. Okay. Besides that, similarly, we can have say Nagpur oranges. In that season, they are good. Whereas we can, we also import oranges, quinoa from other countries. So the same problem. Same thing, fresh vegetables but can provide us many essential vitamins, nutrients which are locally grown. Carbohydrate, we are all good in that. We have enough sources, rice, wheat, everything is there. So of course we are taking more of carbs. Our Indian diets typically lack protein. So there we need to focus. For non-vegetarians, traditionally we eat non-veg say once or twice in a week. And there's a misconception that having non-veg frequently can cause, health issues, but not like that. So if you are having, say, as I told, for a basic person also 1.2 grams of protein per kg body weight is required. And those who work out more, it can be 1.4 or 1.6. So that much protein is required. So we have to decide. Those who are not taking non-veg, they have to get it from the paneer or tofu or, whey protein I mentioned. And then for the non-vegetarians, eggs are there. And then we have fish, chicken, meat. So of course, the processed meat is the one which is risky because most studies have shown that processed meat can increase the risk of colon cancers. But if it's a unprocessed or freshly prepared meat used, and also high volumes, large amounts, there are a lot of, on the media, social media, you'll see somebody will be eating, let's say, 1 kg of red meat every day or say 20 whole eggs every day. Oh, that is not natural. We are talking about 95% of population. They don't require such kind of extreme carnivorous diet. So we need and the protein what we take in a day should not be in one meal. So we have to spread it into 3 meals. So somebody who is requiring, let's say, 80 grams, so it can be say 25, 30 like that. So split it along all the 3 meals because beyond a certain amount of protein, our body can't process. Yes. So it may not help us much.
So tell me one habit which you think affects the brain negatively.
I think we have mentioned many things. So one is that not taking adequate rest. So nowadays what we feel is that the brain has to, every minute should be useful, which means we look at, in this 1 hour, what have we done? And then how it has increased our money or income or whatever, how we have gained from that. It is not like that. So sometimes not doing anything also is good for the brain. So we need, the brain to relax, reset, recharge. Okay. Now it doesn't mean that for 10 hours we'll be just lying on the bed and rotting. That is a different thing. But we need some periods where we are not doing anything. So today, what I see is that, people have got so much involved that they want to utilize every minute and there is no time to relax. So that one habit or, we can say thought process in young generation today, Gen X, where they feel that, we have to work 14 to 16 hours. And we've had some very senior CEOs also of major companies promoting that, you must work 70 hours or in a week. Otherwise you won't succeed.
There was Narayan Murthy's...
Correct. And few others also have told. Of course, in their time, it can be good for an individual person. Because
my 6 is your 9. That
But is it required? Everyone need to work that many hours? No, and everyone can't manage because we know that overworking is linked to high risk of heart attacks and strokes and deaths also. So many studies have shown that those who work 55 hours or more in a week, they are prone to get major lifestyle diseases. So 40 to 45 hours in a week is ideal. So we have to think of not doing anything, also relaxing. And today's world, we are more detached from society, even though we are on the social media, but we are not social. We are not. So when a person may have 10,000 friends on the Facebook, but in real life, no friend. So I have had some cases where, the people have gone into severe depression and they have nobody to talk to, even though they are major influencers of the social media. So what I feel, so it's not bad to have friends on social media, But we need few friends whom we can meet and talk anytime we require. So we need somebody where we can share things. So that is important. So real friends are also
Even many a time on the dining table, all of them are with mobiles.
correct.
Those things are quite prevalent in the present day.
Yes. So, the enjoyment what we get by doing real things, luckily our generation, we have seen both. So we can understand. The current generation, we need to teach them, that yes, the real things are important. Playing a real game of kabaddi, kho, so many games we used to have, gilli danda. So those kind of games. But today, all the games are on the screen. So, and a real game where we, shouted at each other, fought with each other, or, we won sometimes, we were lost sometimes, we celebrated.
Even that helps us to develop the strategic development of the brain, how to deal with a situation to someone bullies you. Now to social media, someone bullies you, it's a one directional. You bully him, then that fellow will bully you back.
And sometimes you don't know whether the person bullying you is a real person,
or
it's
a bot.
So there we need some kind of real life situations are required for current generation.
As an oncologist, I want to ask you one question: that what are the negative impacts of smoking on brain health?
Yeah, smoking, like alcohol, so these two have no good effects on the body. So if anybody is smoking, there is absolutely zero benefit on health. And of course, we know that you lose money because you need to spend money. So there is one habit where you spend money and spoil your health. Now, if you look at brain health, so smoking, because it increases the risk of vascular risk factors, we know that smokers have a higher risk of hypertension, diabetes, and even lung issues, COPD, asthma. And so as a result, they also affect the brain functions, and people are more prone to get brain strokes because of these other risk factors. And also the risk of dementia is higher when they have atherosclerotic and vascular risk factors. So definitely smoking is negative for brain. And in the same way, alcohol also I mentioned, people have told in the past that red wine is good, but those studies were flawed. So because generally people had all the good factors and they also had small amount of red wine.
Secondly, also what happens when we want to say that red wine, we want to take red wine, that time we will only see that one line.
Correct.
We will ignore all negative
So those
aspects.
people who were taking red wine, they were playing 1 hour of golf, they were exercising, they were eating all healthy foods, they were sleeping on time, they were happy people, they had good social connections. So 9 or 10 good things and one negative thing. So the 9 good things overpowered the one negative thing and they had a good and healthy life. But somebody who doesn't do all the 9 things and they also take red wine, they'll have a poor health.
Secondly, another thing I want to ask you, like, does our brain health is defined by our gene, or let us say gene versus habits?
No, it's a very good point you have raised. So many people tell us that, that person is, he's young, he's fit and exercising, eating all healthy, but still he got brain stroke. Okay. So what's the point? So that means the gym is bad, running is bad. It is not that. So earlier we used to say 70-30. So 70% lifestyle, 30% genetic. One very recent study has actually changed that slightly. In fact, now it is even more. So we can say almost 50 to 55% is genetic now. Okay. So it's not a bad thing. We still have 45% in our hands. So you are right. So our brain health or even general health as such, more than half, slightly more than half comes from our genes. So if we have parents and grandparents who reached 100 years of life, we have a good chance that we also can reach. If we had parents and grandparents who died in 40s and 50s, then that puts an undue risk. We have some methods to check, like there's a marker called lipoprotein A, which if it is elevated, it's a marker that it's a genetic risk is higher for us. But it doesn't mean that we don't focus on the lifestyle. So if we have genetic risk factors and poor lifestyle, then if our parents died at 50, we will die at 40. Okay. And that's what is happening to some of the young people who are suffering from heart attacks or strokes. So basically, the basic idea is let us not bother about things that we cannot change. In that, one is genetic risk factor. Second is our age. We know that all the diseases become more as we grow older. We cannot reduce our age. And also gender. Some things are gender specific. But what we can modify are these things we talked about. So sleep, healthy diet, exercise, minimizing the stress, and developing all healthy habits.
From what age should these preventive measures be started?
I would say from childhood. So because, what has been shown is that children who were overweight or obese, they have a higher risk of developing obesity in adulthood also. And they have a higher risk of developing metabolic disorders also. Similarly, children who exercise or young adults who exercise in their 20s and 30s, that benefit was seen in 60s and 70s also. So any exercise what we have done in the past, it is not going to be wasted. Suppose somebody exercised till the age of 40, unfortunately at the age of 45, he suffered a spinal cord injury due to road accident. So he cannot exercise. But that person, because he exercised for 20, 25 years earlier, so that benefit can carry him into 70s and 80s also. So whenever possible, and even the strength training, now there are WHO guidelines which state that even children can start strength training. Of course, they won't lift the dumbbell. For children, there are different ways like, doing push-ups or squats that children also can start. So I would say the right time to start exercising is childhood. They can play games, many things they can do as a child. Similarly, healthy diets. Now if children get used to this kind of snacking, unhealthy, ultra-processed packaged foods, having this carbonated soft drinks and high salty snacks, then there are high chances that they will carry it forward in adulthood. And also they are at a higher risk of developing hypertension. Nowadays, there are many studies in India where adolescents, they have dyslipidemia, abnormal cholesterol, even diabetes, hypertension in teenagers. And that is because of their lifestyle. They are also having sedentary lifestyle and having unhealthy food. So the right time to focus is, and then also sleep. So sleep disorders are common because one thing is, they have to spend 1 hour on the screen extra, which we didn't have. And most of them have to catch an early morning school bus. So for that, they need to wake up early. So they have lost 1 hour at night and 1 hour in the morning because of this commute in the school buses.
One book I read, sir, it was of James Clear, Breath. So very nice thing it had written that normally we breathe so many times, but we don't really recognize or realize that we are breathing. And it is at that point of time when you consciously think from your brain that you are now breathing, you are inhaling and exhaling. And that is where the concentration happens and you get into a kind of more focused situation or in your day-to-day life. So how do you feel breathing exercises or breath can really control the heart? We have spoken like in the beginning. So how does the breath relate to brain?
Definitely. See, the breathing is one of the basic things which we do throughout our life, even during sleep time. Unless it's an online curse where the person stops breathing. So basically, breathing never stops. During sleep, our breath rate becomes slightly slower. And what you mentioned, so if we have a conscious, slow, deep breathing, it's a very good form of exercise. Not only told in our yoga, but also in the modern medicine, there have been research focusing on that. So if we have, say, let's say deep, slow breathing, so by the time we breathe only say 5 or 6 times in a minute, so it improves mental functions, cognition, concentration. It also lowers the blood pressure. So it has a soothing effect on the blood pressure also. So overall health also improves. There's one more thing what we can do is something called as breath holding. How many seconds one can hold the breath? So of course you have to pinch both the nostrils and then time it. How many, and the longer you can hold, better your health is and better your survival chances are. So breathing exercise should be done by everybody. Of course, those who have a medical problem, they should talk to the doctor first and then start. But these are useful things to do with good effects on the brain and other body part.
Many people being scared or being apprehensive, they come and ask, "Hey, doctor, I want to get a scan done. I want to get MRI scan of the brain done so that anything is there or not." How is it? Is it ever recommended or how can...
Yeah, see, we have to believe in the process, not the result. See, today we are all focused on the result. So if a child says, if a student says, I want to look at the marks, so just if my marks are good, so marks don't matter much. What matters is the student, how much he knows the subject and how much he has prepared. And if a student knows the subject very well and scores only 80, whereas somebody else by fluke, he read only say 8 chapters and left 5 chapters, and questions came from the 8 chapters, he can score 100. So for me, the student who knows 12 out of 13 chapters and scored 80 is better than somebody who read only 8 chapters and scored 95. Similarly, a person who is doing all the processes, is sleeping adequately, doing regular exercises, eating healthy, and with all these things, and then let the report show anything. Okay, so I tell such patients that see, the report you can do a scan today. It just tells that you are normal today, but does it mean that tomorrow or the next day it can't happen? So I know of many people who did a treadmill test today, and within few days they have suffered heart attacks also. So the tests, one is that they don't pick up everything. They can pick up, say, brain scan can show tumors, or if any clot has formed already in that brain, but it can't pick up a clot that will happen tomorrow or after a week. So for that, the basic thing is to believe in the process, follow the process, which can keep us healthy. And once in a year, some blood tests are recommended. So that can be done. But routine brain scans are not required by anyone. It doesn't help.
For a routine person of 40 years or 50 years, what are the blood tests you are recommending for people? Let us divide it as a person who is on a routine life or someone with a exercising regular exercise.
Yeah, so basically we look at the metabolic risk profiles. In that, say if you're looking at lipid profile, so lipid profile, nowadays we have apolipoprotein A and then A1 and B. And then if you look at other risk factors like say sugar, so we need fasting blood sugar, postprandial blood sugar, HbA1c. Even early we can look at insulin resistance. So somebody wants to see, we can have fasting serum insulin and then fasting glucose and calculate HOMA-IR. So these are the metabolic risk factors. Even simpler thing is to check the waist circumference, and if it is, it should be below 90 for a man and below 80 centimeters for a woman. So that also gives a good idea about the visceral and abdominal adiposity. And then we need to check the hemoglobin also, because anemia is prevalent in our country. Show other blood tests for deficiencies which are common. So iron and ferritin for the iron deficiencies, B12 and D because those deficiencies are common, and maybe one test for the kidney functions and one for the liver functions. So I think this is the basic thing we need to look at, and plus additional tests as depending on the person's risk profile. One echocardiogram should be done in somebody who's applying to exertional activity, because say hypertrophic cardiomyopathy can be missed unless we don't do an echo in a person who's planning to do long distance running. So few anecdotal reports are there of say out of 1 lakh marathon runners, 1% does die. And there it can be in a younger person below 35, it is HOCM, which can be picked up in echocardiogram, and above 35 it is coronary artery disease, which was not detected. So of course somebody who's planning to do long distance running, they should have a cardiac evaluation done, and whether to go for CT coronary angiogram or calcium score, I think they should discuss with a cardiologist, and depending on the risk profile, they should do. Routinely, I would not suggest for everyone.
Like I have been running. So once during New Delhi Marathon in the expo, I got high blood pressure checked, and they told your diastolic, systolic was more, and also diastolic was 96 or something. And then I thought, अरे यार मैं तो इतना भाग रहा हूँ, मेरे को कैसे होगा? Then I ignored it. In the meantime, after a few days, one of my cousin brothers had a stroke. And then that panicked. I got panicked, and then I got it checked for over 4 to 5 days, morning and evening. In the OPD, I'll go and I'll tell the sister to check it. And even sitting down, lying down, all that. And I found that consistently my diastolic is on the higher side. And then I started taking medicine, and now it is controlled. So my point is basically many of the runners or routine normal people,
Yes.
they will have a silent kind of hypertension or dyslipidemia, which they ignore, where
Yes.
a routine blood test can actually
Correct.
help.
So your point is very valid. So, just because somebody is going to gym or somebody is running or somebody is cycling and from outside they look healthy and fit, it doesn't mean that inside also they are healthy and fit. So these activities, they reduce the risk, but the risk is not 0% still. So say without exercising, if suppose risk is 20, by doing all these things, the risk may become 5. So it doesn't mean that, somebody who's exercising will not have diabetes, will not get high BP, or will not have normal cholesterol.
Again, the genetic thing is
Correct. So we just mentioned, so 55% genetic, no. So we need to respect, and if we find that we have high BP and you have done the right thing by starting medication, so we should not feel bad that we are taking medicines. Because if you take medicines and control your BP and keep it below 130/80, then you will not suffer. The risk of stroke and heart attacks are less. But if we
many
see,
people don't take medicine,
Yes.
thinking that I don't want to take. If I start BP medicine, it will
correct,
not. I cannot stop it at all.
Yes.
So that is a wrong concept.
wrong concept. What I tell the patients is that don't, it is good to hate the doctor, medicines, and the hospital, but that need will not come if your health is normal. So keep your BP normal. Of course, lifestyle interventions are the first step. So if you're already taking healthy diet, exercising, sleeping well, and still the BP is high, so then don't take chances. Keep it normal, because we see every day patients who have stroke and heart attack, and there are 3 or 4 major risk factors: high BP, high blood sugar, high cholesterol, and then smoking. So they are things, and not sleeping adequately. So control them. Keep all the risk factors normal. Then because you hate hospitals, the need for hospital will not come.
So before we end, I would like to speak about artificial intelligence, because that is the buzz in the present day. How does artificial intelligence change your practice as a doctor, and how does artificial intelligence change your patients, their approach towards you?
So first of all, we all have to use artificial intelligence. But we have to use artificial intelligence intelligently. Okay. Now that is the catch. So one thing is that we should not over rely on AI also, because if you rely too much on the AI, then because we all have some kind of knowledge and experience. So as a doctor, we should use our clinical acumen, clinical judgment, come to a diagnosis, treatment plan, and then nowadays, but AI can be useful. Suppose you are seeing a very complicated case, difficult case, a patient has multiple problems, and you are not. So sometimes if you just feed the history and investigation findings, it may give you 4 or 5 possibilities. So sometimes if you have not thought of something, there it can help in diagnosis. Second thing is the treatment. So nowadays, new treatments are coming almost every day. So sometimes, it is difficult for us to follow 30, 40 medical journals at a time. So you could, as a start point, you can say, okay, fine, I'm going to treat this acute, new dementia. In dementia, we know there are many new drugs that have come. And all of us are not familiar because they're not available in India as of it. They'll be launched this year. So if you want to read about newer therapies, then that could be a starting point. Thirdly, I use where, patient may be on 5 or 6 different medicines. We don't know which medicines can interact and things like that. If somebody has suffered, patient says, doctor, I started taking this tablet, I'm having this side effect, which we have not seen before, but something which may be rare, we can take help of AI and then we can correlate. But if you have a medical problem, this for the patients, don't let AI diagnose and don't follow the treatment there, because it can go wrong. So there is no substitute for real doctor's consultation. Of course, you can go through it. You can frame a set of questions which you need to ask the doctor and clarify your doubts. But follow the treatment, what the doctor says.
So my last question is, so much of misinformation is given by so many influencers or the celebrities about brain health or supplements. How can a person judge what he or she should follow?
Very important question. So the advice we have to follow, it should not be based on the number of followers, but the specialty. So suppose I need an advice on the cancer. So if Dr. Suman if you have said something, I'll follow your advice because I know that you're oncologist. Now, whether you have 10,000 followers, even if you don't have 1 million followers, but I know that you're a qualified oncologist. So the cancer advice I should follow from you. If there is some cine actress or some Bollywood actress who has, let's say, 5 million followers, and she says that, I ate this Karela, or I'm just taking example, and then that has cured my cancer. You should be careful. She has too many followers, but it is not coming from a person who is qualified doctor. So even if you may read that, but check with an oncologist and then verify whether it is correct or not. But if it is regarding something to do with the movies, okay, of course I'll follow, what the celebrities are saying about because the doctors
Durandar is good or bad.
good or bad. I'll look at their opinions. Okay. So similarly about nutrition, so qualified nutritionists, they can give an advice. But I would say, cricket player who has 2 million followers, okay, it has worked for him, but that is individual. But that advice may not apply to everyone. So if somebody says, okay, I followed this diet and very celebrity player, okay, fine, we like you and we have, but whether it will work for me or not, I should sit with my doctor and nutritionist and then apply on myself. So that is the thing. So medical advice, follow the real medical doctors, and then you are safe.
Thank you very much, sir. I believe our viewers will definitely be benefited by the discussion that we had, and thank you very much.
Thank you. I also enjoyed this discussion a lot, and I also learned many things from this. Thank you.
Thank you very much for watching till the end. Please, if you have found value in this podcast, do subscribe us and share it with your friends.